some diet and some of the food changes that you can make, you can also incorporate exercise into your daily activities, and that will also help to either reduce your blood sugar if you've already been diagnosed with diabetes, or to help and prevent it if it's something that you are at risk for developing. And so what's recommended by the American Diabetes Association is 150 minutes of physical activity per week. And that sounds like a whole lot when you think about it in that big chunk. But if you break it down, it's actually 30 minutes, 5 days a week. Now, if you're not there right now, what you can do is maybe start with a 5-minute activity per day and do that for a couple weeks and then gradually build up. So this isn't something that you have to come out and do all at once. It's something that you should kind of focus on your body and what you can tolerate and then build up to that 150 minutes per week. There's a lot of different things that you can do that count as that exercise. So walking, swimming, biking, hiking, anything that you can think of as increasing your heart rate. So when your heart rate is up, that's something that is considered an exercise that you would do for 150 minutes per week. Things like weightlifting are also great exercise, but they would be in addition to these exercises that are increasing your heart rate. Now, before you start out and try to develop a new exercise routine, you want to talk with your physician or your primary care provider and make sure it's something that's safe for you. Sometimes there are different conditions with the heart that may make exercise difficult or even dangerous. So you want to clear that with your physician first. And then once that is cleared, gradually build up with the exercise until you get to where you're tolerating it. You can exceed this 150 minutes per week, so this is in no means a maximum. It's just a goal to set and to work towards. And then be mindful of injuries or any kind of pain. So if you've had knee replacement or hip replacement, thinking about maybe speaking with physical therapists, speaking with your primary care provider to make sure that you're doing exercises safely, always stretching before and after. Even if it is a 5-minute walk, you should do a little bit of stretching just to get your muscles and your joints ready for that impact. And then, you know your body and you know what's normal for you, whereas I can't say what's normal for your knee pain if you've had knee replacement. And so just being aware of, your maximum or how far you can push yourself when you're exercising. If you have been diagnosed with type 2 diabetes, you may have heard your physician or your primary care provider refer to your goals. So they may say you're above goal, you're not meeting goal, you're right at goal. So what does that actually mean? And the American Diabetes Association sets out goals that have been shown to significantly reduce your risk of having complications related to diabetes. And so if you can fall within these goals and achieve them, then your risk of having problems that are associated with diabetes down in the future, 10, 20 years from now, is going to be significantly reduced. And so that's why your physician's probably talking about them a lot. So there's a couple different ones to think about. The first one is your fasting blood sugar. And so this is going to be first thing when you wake up in the morning before you put anything in your mouth to eat. And so this you could check with like a glucometer or a blood glucose monitor if you have one of those. And the goal would be to fall between 70 and 130. So if it's less than 70, that's actually considered too low, and that would be something that you would need to treat to get it back up into this range here. 2 hours after you eat a meal, doesn't matter what meal it is, breakfast, lunch, dinner, it should be less than 180. So 170s, 160s, 150s. And again, this is the number that you would measure if you had one of those blood sugar meters at home. The final thing that is being assessed, and this is happening in your doctor's office, is your A1C. And so what this number says is over the past 3 months, this is what your average blood sugar has been. So when you go in for this lab, you don't have to be fasting because it's looking back. So if we were saying, it's October or something, it's going to be all the way back to the middle of the summer in July through October. So you're going to have several months. So you don't have to be fasting. And the goal for this number is to be less than 7%. So that number looks a little bit different in terms of the size, but just remember this A1C is a percentage. And so less than 7% is the goal. And these are the numbers and these are the goals that are going to decrease your chance of complications related to diabetes. In terms of diagnosing diabetes, specifically type 2, there's a few different criteria that are out there. So if you meet any of these criteria that we're going to talk about, that would be consistent with the diagnosis of type 2 diabetes. So the first one is the fasting blood sugar. So remember, that's that first reading when you wake up in the morning, you haven't eaten anything, or you go to an appointment with your physician and they tell you to be fasting, don't eat before you get here. So if that number is 126 or greater, that would mean you have type 2 diabetes. The other thing is 2 hours after you eat a meal. So sometimes your doctor will do something called a glucose tolerance test, and they'll have you drink a big volume of like a pure sugary drink, and they'll consistently be checking your blood sugar after you drink that. So that could be a way that they could determine if you have diabetes 2 hours after you drink that big sugary load. Or any meal that you would eat normally in your home, if it's 200 or greater 2 hours after you started eating, then that would be consistent with diabetes as well. And then finally, your A1C. So remember, that's that value that is the 3-month blood sugar average, the one you don't have to be fasting for. If it's 6.5% or greater, then that would be type 2 diabetes. And so most of us, if you're 40 years or older, should have had at least one of these, if not multiple ones of these checked before. So if you're not sure if you've had it checked, or you know you never have, and you're over that age, or you're overweight, you have a family history of diabetes, you have some other problems like high blood pressure, high cholesterol, you certainly should have had at least one of these checked, and it should be consistently checked every 3 years. So make sure you ask your physician if you have been assessed for diabetes to make sure that you haven't actually been diagnosed and you're unaware. So as I mentioned, I see patients at Park Ridge Endocrinology, and I provide a lot of education on different topics related to diabetes. And so I thought of just a few frequently asked questions that I encounter, and maybe some of the same things you're wondering. So the first one is organic food better than food that's not organic? Or should I shop at certain grocery stores versus others? And to date, there isn't any evidence to say that it's actually healthier for diabetes or for your heart to eat organic versus not organic. And it probably stems from the fact that just eating organic doesn't mean you're eating healthy. So if you eat a whole loaf of bread that's organic, that's still going to raise your blood sugar significantly, and it's still going to potentially cause some damage because your blood sugar is going to be high. And so eating organic, if that's an option for you and that's something you want to do, that's certainly a great idea, but you just have to keep in mind that balanced plate, balanced snack approach when you're eating organically. The other thing that we mentioned is a lot of time labels are deceptive. So you can pretty much bet if something says on the front of the label that it's sugar-free, they either added more fat or more salt, and vice versa with all of those. If it's fat-free and it still tastes good, they probably added some more sugar, and they probably added, some other things that probably aren't so good for you. So again, being very cautious and always looking at the nutrition label. Fruit juices are not really a good source of sugar. If you like fruit, it would be preferable to actually eat the fruit itself because it's going to be more nutritious and it's not going to have so much sugar added. Some things in the grocery store, especially the things in those middle aisles, are prepared. They have a lot of preservatives in them, and our two big preservatives are sugar and salt. And so if you shop on the perimeter of the store to the more fresh foods, then you don't have all that extra added sugar and salt to worry with. The next thing is, you talking a lot about counting carbohydrates, but should you count fat and should you count calories? Well, the fat is going to depend on if you have other conditions. So if you've had heart problems, you've had a heart attack, your primary care provider may have requested that you start looking at how much fat you're eating, specifically maybe reducing your saturated fat intake. And so that's something that's really specific to each individual. As far as counting calories, there's not really a benefit with that because all carbohydrates have calories, all fats have calories, all proteins have calories, and those are our three big nutrients that we eat. So if you're reducing your carbohydrates, you're naturally going to reduce your calories. So you don't have to worry as much about counting those. The next thing is, we mentioned several times about checking your blood sugar, goals that you should be setting for yourself before meals or after meals. And is there one better than the other? Well, there's not really. They're all going to differ. If it's something that you want to get more information on, they're all over the internet. There's demo videos all over the place that you can look and see. They're all going to tell you the same thing, what your blood sugar is in that exact moment. So you want to find one that, maybe you like the color screen, maybe you like one that's smaller, different preferences you may have that you can use to determine which one is best for you. And then finally, one thing that's really big, and we could probably talk a long time about, is preventative care. And so we mentioned some of the complications of diabetes, or we didn't specifically mention them, but we mentioned all these methods to try to prevent them. So watching the carbohydrates you're eating, exercising, checking and keeping a watch on those blood sugar readings. And so other things that you can do are have good foot care. And so patients with diabetes are at an increased risk of losing feeling in their feet. When that feeling is lost, sometimes it can lead to things like amputations, because it's almost like the limb kind of dies off in a sense. And so keeping good foot care, keeping appropriately fitting shoes, maybe even being fitted for shoes, having a foot exam. So if you have diabetes and your feet have never been looked at by your physician or any provider, requesting that. It's something that should be done every year. The other thing that should be done every year is having an eye exam. And so this is an exam where you go to the eye doctor, and what they do is they dilate your eyes. And so if you've had this done before, you remember it because you probably had to have someone drive you home because it makes your vision very blurry. But they dilate your eyes and they go in and they look at the small little blood vessels in your eyes to see if there's any sugar that has caused damage in those. The other thing would be keeping up to date on vaccines, making sure that you're talking with your doctor about different lab work that comes back. Kidney problems are very prevalent in patients that have uncontrolled diabetes. And so talking with your doctor and seeing, is your kidney function declining? Is it staying the same? Because those are things that could, maybe change your course of therapy for your diabetes, that may resonate with you a little more if you don't have good control of your diabetes at this time. But getting to those goals that we've listed previously, your blood glucose readings at home as well as your A1C is what can prevent all those complications. But you still want to have some of those preventative care measures in place routinely.